Adult care in different life stages. Introduction to the module. This module will teach you about caring for adults throughout the different life stages from early adulthood to the end of life. You learn about palliative care, including what it is, the different types and the challenges to providing care. Topics to be covered in this module are young adults, aged between 20 and 40. Middle-aged adults, aged between 40 and 65. Older adults, aged 65 and over. Considerations for adults of all ages. Palliative care. Summary. Young adults. For nurses, it's important to consider the age of the patient they're caring for, as this will assist them in determining how to best care for them. Young adults are those aged between 20 and 40. With young adults, it's essential to assess the patient's circumstances to determine what developmental stage they're at or stuck at. Assess the patient's lifestyle to understand the responsibilities they have, for example, parenting duties during a period of illness, injury or hospitalization. Support them in transitioning through the 6th psychosocial stage, intimacy versus self-isolation. Health needs of young adults. The changes that occur between adolescence and adulthood are quite significant. Young adults are just beginning to establish their sense of identity. Providing support and treatment for mental health issues amongst young adults is every healthcare professional's business. Mental health should be given the same priority as physical health. Experience of young people in acute medical units, AMU. Young people make up the minority of AMUs. Young people in AMUs are likely to be the victim of a condition that severely affects their functioning. Irrational behavioral responses to illness as an adult can be caused by having lots of hospital admissions as a child. The most common mental health problems in young adults. Mental health is something that affects everyone. Amongst young adults, there are more common mental health problems that are experienced: depression and suicidal behavior, eating disorders, substance misuse. Health promotion for young adults. Health promotion is the process of empowering people to take control over and improve their health. Health promotion is especially important for young adults because it helps them to prevent health problems later in life. Middle-aged adults. Middle-aged adults are individuals whose age sits within the 40 to 65 bracket. Middle-aged adults are likely to be experiencing many life changes, and it's essential to be supportive. While working with middle-aged adults, it's essential to be respectful that middle-aged adults have reached the peak of their influence and authority. Support them through the changes that happen as a result of aging. Support them in reaching their full potential and advocate for generativity. Assessing risk. You should assess risk for skin breakdown, hypertension and hyperlipidemia, sleep apnea, skeletal injury, obesity, presbyopia. Older adults. Older adults are those aged 65 and over. Working with older adults requires you to support them in accepting their life as it is and accepting themselves. Risks when caring for older adults. When individuals enter the ages of 75 to 100 plus, there are more risks. Due to smaller, fragile veins, IVs are more challenging to administer. Blood drawing is more challenging. Skin is more delicate, so it can be torn during tape removal. IV therapy can result in fluid overload. Having the correct balance of fluids is more significant for older adults because they can become easily dehydrated, which can cause confusion. Medication safety risks. The medication needs of the older generation are more complex compared to other generations. Older adults might avoid reporting pain or underreport it. Older adults are more likely to experience side effects from taking medications, and there's a risk of life-threatening complications in some cases. To ensure the right medication is prescribed to this age group, you must thoroughly assess the patient and keep documents up to date. Considerations for adults of all ages. Generally, there are some things you should consider when working with all adults. This includes assessing the patient's physical and cognitive abilities, communicating effectively with co-workers and families, supporting patients in setting realistic, achievable goals, considering the impact of hospitalization on the patient's life. Involve families in the patient's care. This includes spouses and partners. Provide gentle reminders about taking it easy for patients who have undergone surgeries. Palliative care. Palliative care aims to provide integrated, holistic care for people who have incurable or progressive illnesses. Palliative care exists to help manage and reduce the symptoms of illness and disease, and provide support to the patient and their family. It's provided on a needs basis. Generalist and specialist care. Generalist care is provided by professionals whose predominant focus isn't usually on death and dying. In other words, care is provided by GPs, nurses and hospital consultants. Specialist care is provided by multidisciplinary teams who specialize in end-of-life care. Key elements of palliative care. The key elements of palliative care are the management of symptoms. This requires constant monitoring of medications and how they're administered. Social, psychological and spiritual support. This can include meals on wheels, specialist services, religious rituals or informal chatter. Advanced care planning. This is about the healthcare professional discussing with the dying person what their wishes, needs and preferences are with regards to future treatment. Managing and standardizing care. The Leadership Alliance for the Care of Dying People, LACDP, was formed after the publication of the Neuberger Report. After talking to patients, carers, the public and professionals, the LACDP developed guiding principles for achieving high-quality care at the end of life. Early identification of those nearing death and prompt intervention and enhance the palliative care. Measuring patient and carer experiences is important in gaining an insight into what works and what doesn't. Challenges to providing care. The challenges of providing palliative care are attitudes to talking about dying, inconsistencies in information provided about health conditions, access to and quality of care, disparities in access to palliative care, and the quality of care they receive. Identifying people approaching the end of life. It's not always easy to determine who's approaching death. Training. Palliative care should be delivered to individuals who specialize in the field. However, general health care professionals can provide this service, which produces unique problems. Coordination. Lack of coordination between different healthcare settings reduces the effectiveness of palliative care. Funding. Inadequate funding for palliative care produces issues in the service that is provided. Summary. In this module, you have learned there are age-specific considerations that you must take into account when working with patients. Health promotion is most important when working with young adults because it helps to prevent illness as they age. Palliative care is provided to people nearing the end of life who have incurable diseases on a needs basis. There are two types of palliative care: generalist and specialist. Advanced care planning is a substantial element of palliative care because it ensures that the needs and preferences of those nearing death are taken into consideration.